Over the years, Black Health Matters has had the fortune to have some amazing faculty to come and speak with our attendees about the process of developing vaccines and why vaccines are important. Let me just share this. We have had Dr. Kizzmekia Corbett, who is actually one of the creators of the COVID vaccine, and that's a sister, y'all. It's Women's History Month. Let me share with you that the first person in the United States to be vaccinated against COVID was a Black woman. Do you all remember Nurse Sandra Bland? And so what we're going to run is a clip where you can see some of those thought leaders, and then we have an amazing panel of experts that's going to come talk to you about it, and please ask them the questions that are on your heart and on your mind. Thank you.
The vaccine development process for COVID-19 and vaccine development in general is just that. It is a process. It is a process that has some level of structural organization and vetting. And the vaccines that come out of the end of that process are deemed safe by the Food Drug Administration. And there are tons of levels of vetting and implanted research in that system to ensure that the general public is safe when receiving vaccine.
And one of the tools I want to talk to you about today is vaccines, right? These are tools that prevent us from getting really sick, right? And how wonderful as parents that we can give that gift to our kiddos.
With vaccine development, typically, there's a weakened form of the virus that is being used.
Vaccine development can generally be split into 3 phases. In exploratory research, scientists experiment with different approaches to find safe and replicable vaccine designs. Once these are vetted in the lab, they enter clinical testing, where vaccines are evaluated for safety, efficacy, and side effects across a variety of populations. Finally, there's manufacturing, where vaccines are produced and distributed for public use. Under regular circumstances, this process takes an average of 15 to 20 years. But during a pandemic, researchers employ numerous strategies to move through each stage as quickly as possible. Exploratory research is perhaps the most flexible. The goal of this stage is to find a safe way to introduce our immune system to the virus or bacteria. This gives our body the information it needs to create antibodies capable of fighting a real infection. So the best way to speed things up is for many labs to work on different models simultaneously. This race to the finish strategy produced the first testable Zika vaccine in 7 months, and the first testable COVID-19 vaccine in just 42 days. Being testable doesn't mean these vaccines will be successful, but models that are deemed safe and easily replicable can move into clinical testing, while other labs continue exploring alternatives. Next stage is often the longest and most unpredictable stage of development. Clinical testing consists of 3 phases, each containing multiple trials. After a successful phase 3 trial, a national regulatory authority reviews the results and approves safe vaccines for manufacturing. Every vaccine has a unique blend of biological and chemical components that require a specialized pipeline to produce. To start production as soon as the vaccine is approved, manufacturing plans must be designed in parallel to research and testing. This requires constant coordination between labs and manufacturers, as well as the resources to adapt to sudden changes in vaccine design. Our best strategy is for labs around the world to cooperate and work in parallel on different approaches. By sharing knowledge and resources, scientists can divide and conquer any pathogen.
Health inequalities is something that is going to be continuous if we don't fix the problem at the root. Obviously, there are social and structural determinants of health inequalities. We as a people are extremely overrepresented in essential services and industries that allow us to be constantly exposed to this virus. And in those types of jobs, they often don't provide the type of health care that one might need or paid sick leave, etc. culturally, we are more likely to live in multi-generational families, and so, or in buildings where, we are residentially segregated, but essentially piled on top of each other. So there is multiple reasons why these health inequalities continue to come about. It was something that happened in the HIV pandemic, and it's happening again today in the coronavirus pandemic.
Prior to me taking the vaccine as well, I did my homework. I spoke to my physician. I did my research into finding out, how is this vaccine being made? What is this new technology, which I want people to know is not new. It's been in existence for a while. So getting yourself educated, talking to people that you trust. And when you don't understand something, ask them to break it down to you so that you understand it, so you can be informed before just saying, I am not taking the vaccine because it was developed too quickly and I don't trust it. But it decreases your risk of becoming severely ill and possibly dying from COVID-19.
All three vaccines do a pretty good job of keeping folks out of the hospital and preventing COVID-related death.
So you have to do what is best for you. And if you feel like you don't want to take the shot and you're fearful, quite frankly, let me just say, be brave and do it. If not for you, do it for your family.
We know every winter there's going to be more viruses. We're going to have flu. We're going to have COVID. We will have RSV. But we have tools that can protect each and every one of you, and I hope you will get your flu shot, your COVID booster. And if you are a little baby, get your RSV immunization, or if you're over 60, get an RSV vaccine as well.
Dr. Mindy Cohen, who is
The Centers for Disease Control.
head of the Centers of Disease Control. What?
Y'all having a good time? You know, one of the greatest jobs that anyone in communication will have is giving out truthful information, especially in a time of crisis. Now, we all saw what happened during COVID. There was a lot of good information, bad information, and then I don't know information. They were still figuring stuff out. I want us to have a very authentic conversation today. Vaccines, a discussion about solutions for staying healthy. I'm going to introduce your panelists. We have Dr. Lynn Paxton, international scholar, who has served as a captain of the Commissioned Corps of the U.S. Public Health Service. Round of applause, please. We also have this amazing individual, a woman who knows a thing or two about how to leverage data to advance clinical research. Kendall K. Whitlock, MPH, is the head of digital optimization for RWE clinical trials at Walgreens. Round of applause. Next, we have Dr. Dimitri Daskalakis, MPH. He is the director of the National Center for Immunization and Respiratory Diseases, Centers for Disease Control and Prevention. Also, NFL legend and community leader Lee Woodall. Round of applause. Lee Woodall is a Super Bowl champion and looks like he could still take out a brother or two. Our moderator, Nicole M. Adams, is also the Senior Engagement Manager of Black Health Matters. Round of applause.
And now that you have your bodies in shape, let's get your antibodies in shape. Okay, Well, Dr. Ruffin-Alexander is not here with us today. She had some flight delays in DC, and we certainly do understand that, but we have an esteemed panel that will definitely fill in the gap. And I'd like to start the conversation by having Dr. Paxson talk to us a little bit about the hesitancy, the reluctancy in our communities and why we are fearful of vaccines.
Yeah, absolutely. This is on? You can hear me?
Yes.
Wonderful. I'm happy to sit here or to stand up, whatever you ever
Make
want,
yourself
because-
comfortable. We all family.
But yeah, right. Well, anyway, for the moment, I'll sit here. Why, about vaccine hesitancy. This is, I've actually been aware, obviously, as all of us have for years, about all of the discrepancies and the inequity that we have here in the United States, particularly for people, brown and black people, people of color, people of ethnic, minorities. Like, there's a huge discrepancy in the care that they receive, and no one's stupid. And we all know this. Now, with the COVID, but what I could say, one thing about what COVID did is it really brought a lot of this to the fore, and we were able, I'd say through the grace of God and science, we had a vaccine that became available a lot faster than I think most people were expecting. I know that I was walking around telling people, don't get your hopes up, maybe if we're lucky 2 years, something like that. Thank heavens I was wrong. We had a vaccine, a highly effective vaccine that came out, very early. And so then we had to start getting people, into it. And here is where I feel like I, as a healthcare professional, slammed right into the wall of vaccine hesitancy. And the one thing I can say is that, something, vaccine hesitancy does not have one single root cause. It is not a monolithic thing. It's not all people who are hesitant to take a vaccine do not all come from the same background. There are some people who are hesitant because of long-term inequities, like in our community. And the one thing that I heard more often than not in the early days is Tuskegee. And, and I understand why, absolutely, because that was a crime that took place, as far as I'm concerned, in the public health realm. So what do I say about that? I'm not going to go on and on, because I could easily go on and on, but I will not. I'm going to limit myself to 1 more minute of talking about this. So I remember one day I was actually out at the Georgia aquarium. We were giving vaccines that day. And I was walking around with this big old sign saying, "Ask me anything about vaccines," because I do that sort of stuff. And so I ran up against a black man. And I was talking, and he came up to me and he says, "Well, I'm not going to do anything because of Tuskegee." And I said, "You know something?" It just kind of occurred to me there. I said, "I believe that Tuskegee was a crime. I believe that it should never have happened, but I don't necessarily believe that it was a conspiracy. I don't believe that people got together and said, how can we harm black people? I think there were other things for this." But I told him, I said, "You know something? But if it had been done by a racist who wanted to harm black people and wanted them to die, he or she would be thrilled right now that 70 years later, people are not taking a life-saving vaccine because of this." And then we talked more, and yes, he got vaccinated. So it's the thing is, I want to just remind people that in our community, the fear of vaccines has a legitimate, has an understandable basis. But we have evolved over the 70 years. As a direct result of Tuskegee, there have been institutional changes made that have completely revolutionized the way that vaccine is conducted, and vaccine research, and all research is conducted. Okay, and so I just want to remind people, we're not living in the same space as 70 years ago. Things have evolved. There are also more people like us, people of color, who are working on these things. one of the Moderna vaccine was actually one of the primary movers. It was a black woman, so I just want to just put that out there. And I'm going to stop talking because otherwise I'm going to keep on going all day.
Okay, that's okay, doctor. Thank you so much. I'd like to go to Lee. Lee, if you would, I know we had a brief conversation about dispelling rumors, and you had some very interesting thoughts as a community leader on how we can do that. If you would share that with us.
Well, in our conversation, what we talked about is that I'm an everyday person, right? Even though I played in the NFL. But one of the things that I said was the lack of knowledge, right? And I'm also a minister. So biblically, I said, with the lack of knowledge, our people will perish. So it was like, are you giving yourself a chance to know you? Meaning to know your body, to know what your heart does, to know what your lungs do, to know how the blood flows through your body. So the fear in which the community feels is because of our knowledge, the lack of it, and not doing enough research on ourselves. What are we allergic to? What steps are we taking when we walk into the doctor's office? And I said, we were having a conversation, and one of the conversations was about when you walk into the doctor's office, that's the first time you get introduced to your body, right? It's the first time you get introduced. It's the first time you get to say hello. They tell you what's wrong, but they fix the problem. But then there's other things that may be going on that you may not know about, right? So we fix the problem, we carry the fear, and then we walk out. But it's time for us to really come together and educate ourselves on who we are. What happens in our body? Doc, hey, how does my heart truly work? How does the blood flow through my body? What about what I eat? What about what I do? What about the toxins in the world? What can affect me, and how can I build up my immune system? So my biggest thing was the lack of knowledge. I mean, it's written in the word. So because of the lack of knowledge, our people perish. And if you look at it, and I'm not against AI or anything else, I actually like it, but I will say this much, it takes away your ability to think and your ability to really know. So if you're sitting there without the trust, you have to ask yourself, have I done the research on myself to know when I walk in the doctor's office, I'm very educated in knowing me?
Thank you so much, Lee. That was great. Dr. Dimitri, I'd like for you to weigh in as well.
Great. Good morning, everyone. Thank you so much, and thank you for being the hostess with the mostest here. So we really appreciate you. So I'll just echo. I think you've actually seen, like, on the stage, sort of what the story is about, like what the goal is for vaccine. So I think everyone in this room, by the fact that you're here, are interested in your health and your community's health, right? And so, right, I mean, that's obvious. Like, you're here on a Saturday, you're like engaging with us, you're hearing about how you can keep yourself healthy. But the other part that you're hearing from everyone who's talked so far is that it's okay to ask questions. So that gentleman that went up to Dr. Paxton and said, I don't want to do this, like, in sort of when you're going to see a clinician, it's okay to do that. It's your body, and your end goal is to stay healthy, and vaccines are a really, really important piece of that. But no one should expect that you just do what we tell you. Like, you should expect is that it's a dialogue. And I think it's like exchange of knowledge, and it's in two directions, because as a clinician, when you're in the room and you're talking to a patient, it's about where are you and where do I need to get you to make sure that you have your optimal health. And there's no like one size fits all strategy. So that conversation that Dr. Paxton had, that should happen in the room. And if you're sitting here saying, I don't know if I need COVID vaccine, I don't know if I need flu vaccine, plug,
Yes.
flu vaccine available outside. Thank you. Is Fulton's doing it? Thank you, Fulton County. So don't forget, it's not too late. There's still flu circulating. So it's about getting to learning what you need to know to be able to really get to your goal, which is the best health that you can achieve personally and the best health that your community can achieve. So let me just give you some stats on the COVID vaccine, because I think it's like really good. Then we can talk about other vaccine preventable diseases, because there's other stuff going on. But the COVID vaccine, let me tell you what happened in the fall. So we looked at people who were hospitalized in the United States in this last fall. 95%, that's 95% of the people who were hospitalized were not up to date with their COVID vaccine. That means that only 5% of the people hospitalized had been vaccinated with the updated vaccine. Knowledge is power, right? So if you're, so rather than saying like, you know, you should get a vaccine, I think it's where are you and what do we need to do or show you, whether it's the good, the bad, and the ugly, the good news or the bad news about the vaccine. Like it, you know, people have some side effects. Usually they're manageable, but 95% of people in the US who were hospitalized didn't get the vaccine. And if they did, maybe they wouldn't have been hospitalized. So it's really how do we get to the place where the knowledge is power and that we're able to talk to folks about like the reality. And like you, as people who are in the room, who really believe in supporting the health of your community and your own health, let's not pretend you are our best ambassadors for your family, your grandparents, your grandparents, your kids, whoever it is, to say, listen, I heard from like a football player, a couple doctors, and someone from Walgreens that here's what's exciting about the vaccine. And really, you are our best ambassadors. Thank you.
Thank you, doctor. Thank you. I'd like to go to Kendall and not change the subject, but as we were talking about the trust that Black and brown people place or do not place in medical professionals, can you talk to us a little bit about Walgreens and what you guys are doing as far as pharmacists and people of color in that industry, and what else you'd like to share with what Walgreens is doing?
Absolutely, and thank you for the opportunity to be here, Nicole, and thank you for that question.
Thank Rosalind.
Thank you, Rosalind, for this invitation. I have been following Rosalind Daniels for a very long time. I'm so inspired by the work that she has committed to on behalf of Black and brown communities in this country. So she is a role model for all of us. I joined Walgreens 18 months ago after 25 years in the pharmaceutical industry, in part because I saw that Walgreens is everywhere. And I've been filling my mom's prescriptions, and she wouldn't mind me sharing that with you, for a very long time. And so I know the convenience that in the fact that we have 9,000 locations in this country, and the fact that 78%, almost 80% of everyone in the United States is within 5 miles of a Walgreens store. Well, for 25 years, and I start looking at the fact that access is an issue in terms of our healthcare as well as clinical trial participation, I think about, well, if Walgreens has all of this physical infrastructure and is in communities where people are, Black and brown and other, then Walgreens and a retail pharmacy might be able to change this paradigm of people who are underrepresented or undersupported in their healthcare needs. So I can't think that in seeing a doctor one time a year, that is going to be a magic bullet for every single need that we ever have, because sometimes things happen between that annual visit, and we have questions and we have curiosities, and sometimes a third of people, for example, in this country are still hesitant to be vaccinated. And what does that do? It leaves people having a higher disease burden. It leaves people perhaps having more of a financial obligation associated with the progression of diseases. We can prevent some of these things. When we heard that COVID vaccines are not standard in communities of color, well, if the country is made up of 13% African American and only 10% of African Americans get vaccinated, but make up 14% of the mortality from COVID-19, we have a disconnect. We have a gap. And how can we encourage one another to look in the face of fear or mistrust? Because similar to the reasons people don't get vaccinated, trust is not one thing. I heard from the good professor, Dr. Reuben Warren at Tuskegee, Dr. Reuben Warren, who said we need to be able to model trustworthiness, not put the onus on people to trust in medicine, because what do people know and understand? They do not have the MD credential behind their name, so what do we understand as just people and folks? If we don't have someone that's trusted in our community that can be a spokesperson, there's CPR, for example, certification in your community. Every community in this country has a CPR certification. How come we can't make getting information about vaccination available to all people, such as through the retail pharmacy, which is right in your neighborhood. One of the things I love about Walgreens is Walgreens, for 120 years, founded by one man, one pharmacist. The pharmacy is somewhere a lot of people go on a monthly basis to fill prescriptions, right? So you're seeing that pharmacist and those technicians much more frequently than you may be seeing your MD annually or for any other condition. But one of the things that I love is in transforming into becoming a healthcare company by strategically partnering with primary care medical physicians. Why? Because 15% lower primary care is accessible, or African Americans, for example, have 15% less primary care than other communities. And that inconsistency in care might be addressed right in your community by your pharmacist in certain cases. Low acuity services. You know how many times you tried to get an appointment the day you had a problem and you were told you needed to wait how many weeks to get seen? Really? If you could get some of that addressed, like blood pressure screening, I'm feeling some sort of way, you're gonna wait 6 weeks? Or you might go to where there are healthcare professionals who are trained to address those specific needs. And I think that in seeing what happened during the pandemic, and I will be brief, what we saw during the pandemic, we ran a health equity vaccination initiative and vaccinated 67 million people in this country, 40 million of whom were in socially vulnerable communities as defined by the CDC. So in the industry that I came from, we often hear professionals saying, oh, they are so hard to reach, or we have to do more, it's complicated. Well, these communities came to Walgreens for their shot. There were 1,500 vaccine clinics. HBCUs were engaged with Walgreens. Church basements were engaging with Walgreens to bring the community what the community need, not the reverse of waiting for people to show up through the doors. So this was an organization that, oh yeah, I didn't even think about it as a job. I'm like, this is who we want to be. So the fact that I get to do who I want to be with people who are also about that, I don't work. I do what I'm trying to do to affect change that I have been working on for 25 years. So
That's a great point, Kendall. Great point. I remember my first COVID vaccine was done in the basement of a church, and I had to go through 6 or 7 different people to get the appointment. But this is a great segue for either our doctors on the panel. What exactly is being done to reduce health disparities and access to vaccines that are needed in our community?
Well, maybe we can start with the local level, and then I'm going to turf it over to Dimitri to talk about this. So what are we doing here at the local level? You know, we are doing a lot.
The local level is?
The local level is, I'm talking specifically about Fulton County. Also, actually, in general, about the metro area, you know, which is like DeKalb, Fulton, Gwinnett, Cobb, those areas, because we're doing sort of similar things. But I'm particularly proud of Fulton. I think we're doing even more than other groups, so, you know, particularly to reach out to people who are traditionally underserved. So the first thing to do is to first identify that you have a problem. And I know that sounds, you know, sort of basic, but it is, sometimes it just doesn't get done. So we took a look at our own statistics to see who's being able to access services, what services are available to them, and of course during the whole vaccine, during the COVID pandemic, we, you know, honed in on vaccines, but actually that tracks very much with other medical services, other preventive services. Then we also keep up to date with what's going on in the community, like the closure of the Atlanta Medical Center had a huge effect. Below I-20, after that, there was no emergency, you know, room available for everyone. There was no hospital available to everyone. It had a huge effect. So what we've done is that We at the Board of Health have worked very closely hand in hand with Fulton County government, which I will give all props to them, have stepped up and worked with Morehouse School of Medicine to map, again, the different health equity, disequities, I should say. And to something that just in Fulton County, that if you live up in the north, Alpharetta, Marietta, and all that, and you go to an emergency room, you're probably going to wait like 20 minutes. You live below I-20, you're going to wait like 3 hours to see somebody. So the first thing, so we have that data, and then the next thing is you have to then act on it. So what has been done so far, in conjunction with Fulton County government put in millions of dollars to work with, for example, with Morehouse School of Medicine to open up another primary care center there. And I'm just using this as an example. We have people who are representative from Grady. We have, they're doing a huge amount of health equity work. And the important thing is we are going out into the communities. We're working with partners to bring them in, to make them know what is currently available, what we're doing to make more things available, and what we also want to make sure we do. Last thing I'm going to mention, because again, I could talk for hours about this, but it's not just race too that makes somebody have a problem accessing care. For example, if you are a drug user, then we know that we have been for a while and continue to be in a crisis with fentanyl, flooding the market, with opium overdoses and all that. And so it doesn't matter what race you are, if you as a drug user are being disadvantaged. So we opened up again in Fulton County. We are the first health department in all of Georgia to be doing syringe exchange, so that, to at least cut down on the possibility of people becoming infected. We have a sexual health and drug users clinic in which we are, we bring people in for non-judgmental care. For those who are ready, we work to get them into rehabilitative services, and we have flooded. We're doing what we can to flood all of Fulton with Narcan to prevent opioid-related deaths. So that's what we're doing. Again, I'm just giving you a 5% taste of some of the things we're doing here on the local level. And of course, we have people here who can address. And I'm looking at Dr. Dr. Dimitri. I was thinking of him as Dr. Dimitri about talking at the more national level. But everything starts local. Or it starts and ends local, I would say, too, because we're the get things out to the end users.
Thank you so much, Dr. Lynn. We appreciate that. Now, we've heard a lot about COVID, of course, but a lot of us have heard of RSV that affects infants. We did a webinar on RSV a couple of months ago, and it affects babies. And then we've got the other spectrum of 65 plus. I won't say where I am, but we've got that other spectrum. And so I'd like to have older babies. Thank you, Dr. Dimitri. Older babies. Can you handle that? Can you address that, please?
Absolutely. So first, I know that Lynn wanted me to talk a little bit about the national sort of.
The floor is yours.
Then I'll do RSV. So first, I think one of our most important programs nationally that we work on is Vaccines for Children. I'm not sure if you all know what that is, but 50% of kids' vaccines in the United States, this is not just COVID, 50% of kids' vaccines in the United States come from VFC, which is a program that supports some of the work that Dr. Paxton does. And I'll give you an important example about sort of why it's important. One, it's one of the most powerful health equity interventions that we have ever seen in the United States. Right. So we literally have seen that because of that, so many of the gaps that we are seeing in equity around children have really narrowed, because it's about access and also building confidence, which I think they're the two parts, right? So it's do I have access? Can I find it? And do I believe in it? And with kids, like we're seeing that we've prevented, literally like 475 million illnesses, 1.1 million hospitalizations. Sorry about that. And not that it, hello. Not that it, not that the money matters as much, but just because that's what people listen to. This equity program has saved the United States 1.1 trillion with the T dollars for every $1 spent on the program that helped really achieve more vaccine equity in children. We save $10. So equity isn't only good because it's the right thing to do. Equity work saves resources so that we can invest it otherwise. What about adults? Well, we don't have a vaccine for adults. So call your congressman, write to your senators, because it's in the president's budget. And if we had a vaccines for adult program, it would look really similar. So in the meantime, we have Bridge Access. And Bridge Access program, thank you Walgreens for being a partner, about over 1 million doses of COVID vaccine have been given to uninsured people, which is, I think, a really critical piece. Now I'm going to move on from that because that's just a quick overview because I promised Lynn that I would follow up and then talk about RSV. So this year has been a really big deal in science. And so now we also get to see what a big deal it is in practice, right? Because we can have really amazing science that happens, and if it sits on the shelf, even if it's at Walgreens, if it sits on the shelf and no one uses it, who cares? So there are two really important products came out this year. The one is something called Nursivimab. It's an antibody that we give babies when they're born, and it really shuts down RSV. So we don't have data out from the United States yet, but there are other countries that show that it can prevent up to 92% of cases. That's 92% of cases in newborns. So that's really exciting. We had a supply problem with it at the beginning, but guess what happens when there's demand? 40% of newborns in the US in the first year of the product, and you should look at her face because that's a lot, 40% of newborns this year were protected using that antibody. And we also had a vaccine for pregnant people, and about just under 15% of pregnant people used an RSV vaccine that also did the same thing. So we really made a dent, I think, in RSV. Now for adults, there's vaccines that are recommended for RSV that are for people who are over 60, so the bigger babies. And the older babies who are 60 plus, this vaccine is really important because when you look at who has RSV disease, it's really young kids because their airways are teeny tiny and they get a lot of mucus and then they go to the hospital. And then older folks because their bodies are different, their lungs are different, and that's what happens. And so the vaccine looks like it's really protective, but that vaccine for people who are over 60 plus sort of stayed on the shelf a little this year. And so we have a lot of work to do to remind people that when you think flu, when you think COVID, you can also think RSV, and these things all work to prevent really, pretty bad outcomes. So, millions of doctor visits have been prevented because of the new RSV vaccine, many hospitalizations, many ICU visits, and yes, a lot of deaths. So we just presented that information a couple days ago, but so more to come. But RSV for little kids as well as for the older kids, 60 plus, really those are really great interventions that we have, and we just have to do the same as with COVID, which is to get them from the shelf into people's arms.
Thank you, Dr. Dimitri. And I understand that we have questions from the audience, so if you don't mind, we're going to take a moment. Taj, if you could handle that, please.
Good morning to all. I have a quick question, and I guess it's a comment. Do you think the government played a role in people's apprehension to get the vaccine? For example, you had one party who was in office when the COVID vaccine was taking place, and it was Operation Warp Speed to get it done. And then in September the 5th of 2020, the vice president candidate at that particular point in time said she wouldn't trust Donald Trump with any vaccine that was created. And a lot of Democrats also said that they were in support of that. And all of a sudden then, when the other party won the White House, they kind of urged all Americans now to get the vaccine. And number two, I guess it's a point you can talk about, is the vaccine companies cannot be sued. There can't be a class action lawsuit against vaccine companies that created that vaccine. So I just really wanted to get your take on that.
Well,
Thank you.
Oh.
That's a lot to unpack.
Yeah. Well, let me just jump. Yeah.
And I'm going to let you guys decide who's going to handle it. I'm still trying to digest it.
I'd love to jump into the first. Here, that's working. Okay. All right. That's definitely working. I want to jump into the first part of your question. You are highlighting something that we have learned to our detriment. When politics gets into science, bad things happen. I was actually going to say something else that begins with an S, but I didn't, but I realized don't that happen. And we know this because, one thing, I don't know if this study got enough attention, but, we all know now that because of partisan politics, that there's a difference between, in fact, Republican and Democrat uptake of the COVID vaccine. This group was able to do a study that I guess there's two states in the United States, Ohio and Florida, where they were able to link party affiliation and vaccine use and COVID outbreaks, and they found that if you were a Republican during the Delta, believe the Delta wave that we had, that you were 75% more likely to die than if you were a Democrat, and it was all because Republicans were getting vaccinated in lower numbers. So that is the starkest thing I know that shows that when you let politics get into the mix, people die. Can die. Okay, they die. All right, I don't know. Dimitri, do you want to take the other?
Okay, this is the guy from the CDC now.
So get ready. So I think I'm just going to riff off of what Dr. Paxton said, what Lynn said, which is that, we really focus so much on the sort of COVID conversation about, the COVID vaccine and the fact that, when politics blend with science, bad stuff happens. Is that the S? Bad stuff happens. But I just want to, another really important piece of this is that we're seeing that this really seeps into, in a very insidious way, the work that we're doing for other vaccines. So I'm just going to give the example. So it's not, it's not sort of the same conversation as COVID, but, in 2024 already, I just want to make sure I'm not making up the number. We've had 41 cases of measles in the United States, right? And in 2023, we had 58 cases. It is March. So we know where that line is going to go. Who's getting measles? Almost every single person who gets measles is unvaccinated. And so it's seeping into the sort of politicization of science has really seeped into not only COVID, but all of the other important things that we do. HPV vaccine prevents cancer. Those rates are going down in terms of vaccination. Measles vaccine going down. Flu even this year is lower than it has been before. So I think that we have an uphill battle, and this is the kind of space that we can do it, which is that from the perspective of folks on the street, what's the ultimate goal? And I talked about it at the beginning. The ultimate goal is your health, and having real discussions with your pharmacist, with your doctor, to really see what's right, what makes the most medical sense for you, what makes the sense for your life, and really try to separate it out from whether it's one party or the other, because that road takes us down to more kids getting measles, more people getting hospitalized and dying of COVID and flu and all of the other vaccine preventable diseases.
I'd like to go to, Lee, there, go Lee.
Well, I appreciate everyone on this stage. We've, as the NFL alumni, we've all worked with each of this, with the CDC, with Walgreens, and especially with Fulton County. So thank you for all that you do. So coming from the standpoint of, I'm a part, it's different when a doctor says it, right? You all feel that. It's like, oh, okay, that's what you're supposed to say. It's different when people say it. But once again, it goes back to, what do I know, right? Even when politics gets into the picture, even when they step in, they say things, and you hear so much stuff that it confuses you. It's like, who's telling the truth? Well, they're all held to be accountable, right? So the community is just asking for our government, our doctors, and everyone that makes these decisions to be what? Accountable, right? So if you see more accountability, trust comes in with accountability, right? I know my wife is sitting over there because my wife would say, you know I know the word about accountability. I say that to you all the time, about being accountable, right? So the thing is being accountable. But it's also on the communities to really come together rather than being divided, come together and say to each other that I will take care of you. You take care of me. All of a sudden, that starts to spread like a wildfire. And all of a sudden, when you get sick, I'm coming to your beck and need. I'm saying, what do you need? What can we do? What happens is when we get sick, our communities go separate apart. And they say, oh, it's because of the neighborhood you live in. Or, oh, it's because Walgreens may be 10 miles away. No, that's an excuse, because guess what? If you're my neighbor and I know something's wrong with you, I'm driving to Walgreens to get what you need. That's what we need in our community. And when that starts to happen, thank you. When that starts to happen, that's when change happens. Because change happens at home first, right? Then you take it out to the states, then you take it out nationally. But if we can't come together, then why should they?
Thank you. Thank you so much, Lee. And we're going to let Kendall have our last word.
I would love to just give you an example of one of our 45% people of color pharmacists with Walgreens. So that question was also asked, but I don't think we've talked about it, that 45% of the pharmacists at Walgreens are people of color. And in Georgia, in the local community, Shauna Marks Wilson, one of your local Walgreens pharmacists, has partnered with organizations of all types. One of them was a faith-based organization in Decatur, Georgia. Now, the goal was set. We want to vaccinate 200 people this particular weekend with this church organization. There were actually 3 churches in total, and they wanted to vaccinate 2,000 people. That was their goal. They vaccinated 7,000 residents. Why is that important? Because it goes back to what Lee just said. Each one of us has to care enough to see about the next person and the next person. And so when you meet Walgreens pharmacists, you might find not the person with a white lab coat and a credential, but you will find somebody who cares deeply about the people in their community that they serve, and that for them is not a job, that is who they want to be. So they do things where we had vaccine clinics in Philadelphia. We've had vaccine clinics all over this country because the Walgreens pharmacist in those geographies wants to serve the community where they live, because they know that they may not be supported elsewhere and they may not have the continuity of seeing a healthcare professional. So I think that when we think about the retail pharmacy, again, we don't have to think about it just as the place where expensive products are sold, right? Because expensive pharmaceutical products can be pricey, but it can also be the place where you can talk to someone and ask your questions, not just be spoken to, but be heard. Right? This is a two-way. Dr. Dimitri talked about a two-way dialogue, and I think that the retail pharmacy can become the vehicle through which we improve our health outcomes.
Thank you. Thank you so much, everyone. I believe that is all the time we have this morning. We appreciate you being here, and please stay tuned for the next session. Thank you.